So now you see the homepage for RadMD. You'll notice that there is a spot that you can sign on to RadMD, or if you're a new user, you can select the new user button. In this case, we're going to select that new user button. And for those of you that have not signed up, you'll go to the drop down. And again, the option that we do recommend most people select would be this physician's office that orders procedures or the ordering access. And what you would do is you would complete the rest of the application and submit the request. It takes about 24 to 72 hours in order to receive a temporary password. Just a couple other options going back to the home page now. So if you have questions regarding the clinical guidelines, you can always go to the Solutions tab at the top of the page, click on Musculoskeletal and Surgery Solutions, click on there, and you'll notice that the clinical guidelines and the educational documents are listed on our webpage. Now, for additional information regarding the program, we would recommend that you sign in to RadMD. We're going to go through this. Is just a message that comes up. Just read through the message, and as long as you agree, press OK. And you'll end up at the main menu. From the main menu, you would go down to the Health Plan Specific Educational Docs section. Click on the link, and then it will list all the health plans on the left-hand side of the screen. Select the health plan. It'll show you who is the provider relations manager and any documentation related to that specific program. You can click on the documents, you can print them out, you can download them, whatever you would like to do. Going back to the home page, just to review the main menu, if you need to initiate a new request for an authorization, you would select the request spine surgery or orthopedic surgery. Also, if you want to check on the status of a request, you would click on the View Request Status. So we're going to go into the demonstration now where we'll be able to see this. So here, everyone needs to have their own username and password. There can't be just one generic username and password for the facility due to HIPAA regulations. Again, there goes the warning message. Just read through it, make sure you're okay with it, and press OK. Next, it brings us to the main menu where we're going to go to that request spine surgery or orthopedic surgery for the new request. From here, it's going to show us the steps that are going to be involved in the process. We're just going to click continue. The next screen is going to ask us for information about the patient, their name, their date of birth, and the health plan. The member ID is an optional field. For their name and their date of birth, make sure they are accurate. If any of the information isn't correct, it may make it difficult to find the patient in our system. Next, it's going to ask for the provider that is performing the surgery. So there are 4 different search fields there. You can just select one. In this case, we're going to select the physician's name, and we'll press search. Then the physician's information will come up. Just ensure that it's correct, and then click on their name. From here, it's going to ask us to enter the best telephone number, who should be our contact person, and the best fax number for us to reach you. Now, if you would like to receive all communication electronically, there is a paperless option, and you have the option to either select in or decline that option. At this point, it's going to ask for more details about the actual procedure. So it's going to start by asking a more generic question and then focusing it a little bit more. So it is a surgery. It's going to ask for the surgery site. And then it wants to get even more specific on the actual procedure being performed. Then we'll press save and continue. Next, it's asking where the procedure is going to be performed. Again, there are 3 search fields here. Just select one and enter the information. The information will populate below. Just ensure that the information is correct and then just select the name of the facility. Next, it wants to know the setting where the procedure will be performed, whether it's an outpatient, an inpatient, or an ambulatory hospital where it's going to be performed. Next, it asks for the ICD-10 code. We are going to use our ICD-10 code helper. At this point, you can either enter a keyword for it, or you can enter in the code and it'll give you a better description of that ICD-10 code. At this point, you would actually click on the ICD-10 code and it would be entered. Next, we're going to enter a reason for the procedure. Try and keep that relatively brief. Next, it's going to ask us for the primary, or who is the primary insurer, whether it's a motor vehicle insurance, another party financially responsible, or is it a workers' compensation claim? Now, the data service question is, when are you planning on performing the surgery? Remember, there is a 60-day validity period related to that. So we're going to press continue. And next, it's just getting into specific questions related to the procedure. Again, it's based on the ICD-10 code, so these questions are all related to the spinal surgery we are performing. It's asking if there was conservative treatment performed. We're selecting yes. And then it's just asking you to just thanking you for submitting your request. We're clicking OK and then or continue to next. At this point, we have completed the process. This is a summary slide reviewing everything that we've entered. It talks about the members' information and the facilities information. It is showing the tracking number, which again, before we've received an approval or denial, we do get that tracking number, showing that the answers that we gave to the questions in the algorithm. Next, it's showing the spot where we would upload additional clinical documentation. Remember, all cases do require that we submit additional clinical documentation. So we'd click on that button. We're going to go up to the top and we're going to select where it says upload clinical document. Click on there again. At this point, it's going to bring up the screen where we'd go over to the browse button, click on browse, and we would select the file from our computer. Now we can use any of the file formats shown on the screen. You would just select that file, press open, and then it would give you confirmation that the file has been uploaded. If you do need to upload any additional files, click the upload another document. At this point, it's taking us back to that summary screen. Just because this is an example, this case has been approved, and you will notice that there now is a validity period and an authorization number. We do recommend that you print this out for your records. You'll notice at the bottom are some of those answers that you gave to our algorithm. At this point, we're going to go back to the main menu just to view how you can view an authorization status. So we're going to click on the view request status. At this point, you can enter either the patient's name, their health plan ID, their authorization number, or the tracking number. In this case, we're going to use their name and click name search. We're going to select the member's name. And then it's going to take us to a summary screen. Here on the summary screen, you'll notice a couple of things. This is the spot where if you needed to upload any additional documentation, you can print the fax cover sheet so that you can fax in any information. If you wanted to upload any documentation, you would click right here. Just below it is a summary of the patient's information, the physician who will be performing the procedure, and the center where the procedure is going to be performed. Just below, you will notice there is an authorization number, the current status of the authorization, and if this was approved, it would give us a validity period. All right, well, I thank everyone for joining us for today's webinar. If you do have any questions, please feel free to reach out to your provider relations manager or contact our provider services line. I thank you for joining us. Have a nice day. Bye.